Good afternoon, everyone. Welcome to the Decrypting Forum series brought to you by BAC Engage. Without further ado, I'd like to introduce the panel of speakers. First panelist, Ms. Valarmadi Selvaraj, or more commonly known as Lara, is one of the certified counselors with the BAC Education Group. Moving on to our second panelist, Dr. Hilwa Abdullah, or Muhammad Noor, is currently a lecturer and a clinical psychologist at the Center of Psychology and Human Wellbeing, Faculty of Social Science and Humanities at University Kebangsaan, Malaysia. Our final panelist, Dr. Prem Kumar Shanmugam, he is the Chief Executive Officer and founder of Solace Asia and Solace Academy.
Right. Actually, my screen time increased as well. Just like students, most of the time interacting with them, and obviously, like all my sessions are via Zoom and phone counseling. Some students they are okay with it. Some students they feel very tired because from morning they have attended classes and then discussion with their friends, and again counseling sessions. So, but somehow we try to manage it well with our students.
Yes, it is very much, it gives a lot of impact, especially during this MCO starting last year. But personally, in terms of work-wise and work-related, I think or I feel that I work beyond the minimum requirement or like for appraisal. So it is far more okay than the time that we usually work at office because we have more time. Because we manage our own time. So only work, I have a big family. I have a big family with many kids. So how do I manage my time is when I need to manage my time with my work and also my time with my kids, especially during this PDPR, the school has just opened. So that is another stress thing where I need to look after my kids and also their screen time kind of thing. So, but to answer your question, of course, as for last year, I've managed to achieve more than what is required. Yeah, we have 24 hours, but how do I manage it? It's arrange it accordingly. But of course, my first priority will be my family, my kids. So there is pro and cons living or working in this kind of situation. And again, it's how you perceive it, it's how you take it, and it's how you cope with it.
All the questions are very real, and very applicable and exactly what we're going through. Now, this is actually a condition, and some of us may have heard of this called FOMO, yeah? Fear of missing out. Yeah, we are dependent on technology and information, and now we know that information is mainly being shared through the internet and the cyberspace, right? So we constantly keep checking and looking out for updates because of the fear of just missing out on latest information. And that's actually a condition, Prolonged exposure to that kind of situation and that kind of stresses leads to a condition called FOMO. And it's a form of an addiction as well, because you're so addicted to checking that you constantly check. And that creates a very kind of a neurochemical dependency and changes in your brain. And there's a need to constantly keep checking. One of the symptoms, there are various symptoms of addictions, and one of the key symptoms is anxiety and stress. According to a survey done, I think in 2017 or 18 in Malaysia, 80% of the population are addicted to internet. This is just in Malaysia. And out of that, 60% claim that they have anxiety. And these are not even claims. If I'm not mistaken, maybe Dr. Hilwa can correct me. The study was done with evaluations and assessment tools. So people actually responded and said 60% of them have anxiety as a result of this internet addiction. So it is a serious thing, and it's an offense. It is getting worse as a result of this lockdown and the pandemic and this dependency on the internet. Studies have also shown us that cyber addictions, or internet addictions, they are very similar to chemical dependency. Now, addiction itself, there are two types of addictions, or two families. Yeah? One is known as chemical substance addictions. Another one is called behavioral addiction. So chemical addictions are things like alcohol and anything that's chemical related that you're dependent on. And behavioral addictions are non-chemical related dependency, like gambling addictions or sex addictions or eating addictions, eating disorders, or shopping. Yeah, shopping can become an addiction, by the way. Okay, so don't do it too often. Now, apparently, there is a rise in people who are shopping online. And people are doing it because that's the only way they can shop. And after a while, they tend to get so addicted to it because it serves a purpose that they're dependent on it, that they continuously do it and buy things they don't need. My wife is not around, so my wife is one of them as well. She's constantly on Shopee looking for stuff that we don't need. So my house is filled with stuff we don't need. Okay, that's become another form of addiction as well. Cyber addictions, the symptoms of cyber or internet addictions are very similar to chemical dependency. So the withdrawal symptoms from internet addictions or cyber addictions can be quite similar to chemical addictions. You see people getting agitated, anxious. I have seen teenagers actually withdrawing, getting shakes. They're withdrawing when you remove their games, they remove their computer from them. They get very angry and aggressive. So the studies have found that the dependency with chemical dependency and cyber internet addictions symptoms are quite similar.
Yes, similar.
Maybe physiologically, maybe the body-wise, the withdrawals are not so bad, but it's more of psychological. I think the answer is yes. We should limit our usage. We should plan it out, as Dr. Hilwa said. We need to have specific time for specific things.
It's actually, Dr. Prem, talking about this cyber addiction is not only the effects that our children or the adolescents or even the youngsters have, but it's also involving parenting,
Yeah,
so it's how parents cope with parental stress, and they're seeing their kids on their screen most of the time, and their tantrum whenever we withdraw. There's a withdrawal of asking them to stop playing games or do things other than playing games. So there's a lot of more big issues here by having said the cyber addiction. It's both parties actually.
Communication, parenting communication between the parents and the children is not as productive or as the way we want it to be as before. Okay? We would talk, maybe, I don't know, whether most of the Asian families are open to sitting down, having a chat, talking about it. Now you go out for a meal, you say, Sunday's family day, let's all have dinner. Right? And nobody's having dinner, they're all on the phone under the table, under the phone.
It's the muted dinner.
I actually remember Dr. Hilwa and we had a chat about this, and you told me you remove your phones from the kids.
Yeah. I'm very compassionate in that sense. Whenever we have a dinner, we don't have phones or it's purely for work emergency. But I usually have this pen and pencil, color pencils for my little kids. Then they can just draw whatever they can see in the restaurant. And then for 5 to 10 minutes waiting time for the food to come. And then we communicate, we chit chat, we laugh, and we make jokes. That's it.
So that's all part of parenting as well, right?
Parenting.
Another thing that we tend to do is we are so used to giving the phone or the laptop or the iPad to a child. Okay, the child cries, don't cry, watch a cartoon. You give them the iPad. Okay, don't cry, stop crying. And then you give them the phone to watch. Now, when they watch that, they see that what's happening is it's doing something to the brain, and then they calm down, they relax, or they keep quiet. So the next time they cry, you give it to them again, and then they calm down. So we are actually conditioning the need for them to use technology or digital space to serve the purpose of calming their brain down. And imagine we're doing it as their kids, right? But what I realize is during now, especially with the lockdown and the pandemic, parents are doing it more because we're all living together. We're not so used to being together 12, 24 hours of the day. We spend most of the time at work and we are going out, right? We come home in the evenings, we see the kids. Now when they're all stuck at home together and it's becoming stressful to manage that relationship, we look for shortcuts, iPad, phone, laptop, whatever serves the purpose. So we are conditioning the need further, and definitely it's unhealthy. The pandemic has made it worse, definitely. Become unhealthy.
Like some of them, they don't notice the time they are online, right? Between doing research assignment, like for example, young adults, they have a lot of things to do. and then talking with your friends, updating social networking, and also playing games that I will also include. It's easy to see how, especially young adults, like I said, they lost track of time. The first thing I would say, they should discipline themselves. Okay, self-discipline is very important, where they should have like a timer to set breaks in between. At least like, after your class, you take a break before you start with your assignment, like go down, have something to eat, or maybe you should just walk around the garden or talk to your parents and then come back. And then you can also like what do you call, for example, at night, if you keep your mobile phones or other devices out from your bedroom, you can avoid your screen time. Like you won't be able to stay up late night playing games or messaging your friends. Why I'm saying this, because it can actually help you from being disturbed at night, especially when you receive a notification or messages. You tend to quickly grab your phone and look at it. So that will take like half an hour for you to sleep again. Earlier, Dr. Hilwa mentioned that we should have family rules, which I totally agree with her. This is also to avoid screen time, basically, like they should follow a specific timetable or rules set by the parents, especially now parents are working from home. It's actually very easy to keep track of your children's activity, right? As a parent, you are the important person in the family. Like your parenting style is very important. And then keep track of your children's class time, because you know what time is their class, when they should be online, when they having their break, what time they're going back to do their research or assignment. So yeah.
So as we all know, cyber, or we are in the world of full of technology, is just at our fingertips, right? It's all at our fingertips. If we don't have any answer, we can just Google and it's like kejap saja. So what is cyber actually? So cyber is actually relating, okay, to, or it's a characteristic of the culture of computer. Yeah, computers, any with regards with computers or information technologies, or in fact now we are moving towards virtual reality, internet, smartphone. So those are what we define as cyber, part of it. Okay, but what is cyber addiction is when we fail to control, or the lack of control in terms of self-control using the technology or the internet, for example. So basically, cyber addiction, it's characterized by excessive or poorly controlled preoccupations, where when we have this excessive and we are unable to control, or we have poor control of our screen time, of our usage, whatever, for example, smartphone, then it will lead to any impairments of our daily functioning. For example, we unable to go to class, we are unable to wake up at 8, even to have an online class at 8 a.m. because we have that very poor control of our time during the night before. Okay, so when it impacts our daily living function, so in terms of social, occupational, and also our personal, so that is what we call as addiction, right? So it urge and it modify our behavior towards the extreme kind of changing of behavior. Some kids, they just throw tantrum easily, they feel irritated, they feel helpless because of this extreme use of any form of technology. So all this excessive, again, poorly controlled, and also any kind of behavior with regards to computer use that can lead to impairment or distress. So it is like part of the definition of cyber addiction. So as we know that in cyber addiction, it has a special category and the sort of more or less similar the internet disorder or internet gaming disorder. So it has in the DSM-5, the Diagnostic Statistical Manual, 5th edition, to whereby we use DSM-5 to give diagnosis for any kind of mental illnesses. So whenever the patient or any individual that came to psychiatrists or even clinical psychologists, they want us to rule out So we have these very specific symptoms. If they fulfill the criteria, the symptoms, and then they might get this diagnosis of having this kind of addiction. Usually, to observe, that's why being an adult, especially I'm not sure whether to talk as a capacity as a parent or as a teacher or as a, my respondents or participants, are they college students? Right. So again, we can observe changes of behavior. Okay. Maybe before getting addicted to all these smartphones, all these gamings, all these never-ending informations, yeah? Especially now COVID, we want to see all these statistics, all this news, all these viral kind of thing. So it's hard for us to put away our phones because everything is important. If we miss, we might get that FOMO, Dr. Prem? So in fact, if we miss our friends update, so it's like macam, it's the end of the world. I cannot miss any updates from my friends, right? So that is not a good indicator. So changes of behavior in terms of attitude, personality, right? And if you feel that you are too occupied or preoccupied with the internet, and then at the moment when you start, for example, to have your dinner, your mind or your thoughts starts to think, what happened to my all those in games, especially all these trophies, all these rivals. So you have that sort of thoughts keep on going on your mind. So it says that you are preoccupied with that activity, right? And if you feel that the need to use internet with increasing amount of time, so if you see the changes in terms of patterns, so it keeps on increasing, and thanks to the technology again, because we can sort of audit our screen time usage, right? For example, for me, whenever I consciously knew that I have this self-control of my screen time, so at the end of the week, okay, my phone will give a sort of applause that your screen time has reduced by 31%. So I've got that early of the week this week. So it makes me feel like, yes, I can do this. But again, we have to know that what are the things that I used for that leads to my screen time usage. Maybe it's because, of course, it's lecturing and getting, it's not game. I'm not into gaming. So that is a good indicator when we have that technology. So if you see the patterns of our time usage, it's been on, we are like glued to the screen, to the games, especially kids. So we have to be careful in that. And if you feel restless, of course, moody, depressed, when your mom and the dad says, okay, dah cukup, stop it. You've too much of this game, too much, you are scrolling, YouTubing. Kan? At the end of the day, what did you get? So that kind of reaction, the child could be like, so, marah, tantrum. It's like revenge, tak puas hati dan sebagainya. Right? And if you stay online longer than originally before, maybe for the past 2 weeks, you have this extra time of internet usage. Again, we as a user and also our family, talking about kids, maybe our parents can notice that, your friends can notice that. So we need to have that awareness in terms of behavior changes. And of course, if you have ever lied to your family members or therapists, okay, so in terms of what extent of involvement with the internet you've been using, right? And maybe you use your internet as a way of escaping from your problems. So that could be also a sign of you need help. You need, maybe it's underlying either mental illnesses or mental disorders that you are facing. So you use this internet or whatever with regards to cyber to compensate with your emptiness, loneliness, your low self-esteem kind of thing. So that is some of the symptoms with regards to cyber addiction. I hope it briefly explains to the audience. To identify is when sometimes being user, if for example, I am addicted, I will not realize that I'm addicted, okay? I will not realize. But my family or my parents or even my kids notice, they will say, kids will not lie. They say, Mama ni asyik dengan phone je, example. So it shows that even our kids notice changing of behavior patterns. I rarely talk to them, and I always have my me time with my phone. So that could be one of the clear or obvious symptoms, says that, okay, I have to put a stop. Okay. So other than that, if we receive, for example, if this kind of cases that referred to me, usually we will check on the frequency of the time used and what sort of activity that they use. If it's for learning, it's for gaming, and do this patient or do this individual has more serious of cyber addiction, does that lead to any pornography, for example? Because some patients, they come to me of the issue of pornography, how to combat pornography in their child. But again, when I see the patterns, it's about their extreme or excessively usage of smartphones and other internet materials. Usually we will ask very thoroughly about the family history, about the activities that the patient will usually have a daily.
When patients or when people ask, how do I know when it's an addiction, right? When is it an addiction and how do I know it's become an addiction? So a very simple way to answer the question without being too clinical is that when your life becomes unmanageable, okay? When you realize that without doing this, you can't function normally, and you need to do this in order to function normally. Okay, that's when you've crossed the line and it's become an addiction. Now, how severe it is? Well, basically there are four things: use, abuse, dependence. 3 stages. Okay, use means I'm using it because I'm just using it, right? I need a phone, so I'm using it. Abuse means when I'm using it more than I'm supposed to use it. The doctor said take 2 pills a day. I'm taking 3 pills a day. I'm abusing it. All right. My lecturer says spend 2 hours a day on the internet. I'm spending 3 hours a day on the internet. That's abuse. Now, dependence is the chronic stage where without using it, without doing, I can't function normally. So now I need to get up in the morning, straight away, pick my phone and look at the phone. I need to go to bed. Before I go to bed, I need to look at the phone and go to bed. That's generally how we would define the various stages in addictions, whether it's cyber or any kind of addictions. Now, when it becomes an addiction, it is a mental health disorder. It is a disease. See, addictions is defined as a chronic relapsing disorder. Pretty much like if you have any other disease, medical disease, whether it's cancer or whatever medical disease, it's a disease that you learn to live with for the rest of your life. And addiction is a disease as well. You have to learn to manage it for the rest of your life. More so with cyber, because cyber internet is a necessity. We need it. You see, to function, we've become so dependent on it. So, and I like the way Dr. Hilwa explained this now. We need to be able to divide our time. In fact, the technique of the phone technique usage a week, I think I will fail that technique because my usage increases by the week. It doesn't get any better. More so now, like Lara was saying earlier, the time we use now is more because people all come online to look for us. We don't do that much face-to-face therapy anymore. We do more of virtual therapy. We do Zoom. So we're spending more and more time. And if we can set stopgaps, that'll be helpful. With chemical addictions, the treatment approach is different. With chemical dependency or with behavioral dependency, we use something we call it an abstinence model. Abstinence model means you stop, right? You come into treatment. If you're a heroin addict or cannabis addict or methamphetamine addict, you come into treatment, we will treat you to stop and manage life without it. But if you have an eating disorder, how to stop eating? You can't, right? So that's where we use a different form of treatment using something we call a bottom line approach. With cyber addiction, is the same. So this is how many hours I'm going to use a day, and this is the maximum that I'm going to go. And once I increase that, someone is going to tap on my shoulder and tell me, you need to stop. You have exceeded the number of hours that you can use. So from a treatment perspective, working with cyber addictions is a bit more complicated as compared to other forms of addictions. Now, with addictions itself, there is this concept called denial. Okay. And denial is a very strong defense mechanism that we all use to protect ourselves. So when someone says, hey, you've got a drug problem, no, I don't have an addiction problem. My mother has an addiction problem. My father has a problem. I don't have a problem. This is what we often hear when family members bring their loved ones for treatment. That's a defense mechanism that they have built so strong to protect themselves that they go into massive denial. Cyber is the same. Gaming addiction is the same. When you take the computer away from someone who's addicted to it, he says, no, I don't have a problem. I can still function. I still go to school. I still am passing my classes. I'm still getting reasonably good results. I don't have an addiction problem. So to create that awareness is already tough. You need interventions, you need clinicians to help them understand there's a problem. So set the stop gaps at the beginning itself, set standards, limit the usage, and if you can't monitor yourself, get someone to monitor you. It's very important.
Basically, along my session, I'll tell my students whatever I shared with you guys earlier, like spend more time with your family, limit your screen time, and all this stuff. But again, some students, they tend to show sometimes they can be aggressive, not towards us, but also towards parents. Because sometimes when parents come to us, the counselors, they will share with us saying that I can't control my son or daughter from the screen time. So as a counselor, I'll say it's okay, I'll do my best, right? If I need your help, I need your support, we got to work closely, right? So after the first 2 or 3 sessions with my students, so basically I need parents to cooperate as well. So what parents will be doing, like, no, I already leave my son or daughter on their own, I'm not going to bother anymore, all right? So when parents say those kind of words, this is very demotivating to the child, all right? So they directly will say like, okay, fine, I don't want to come for sessions, all right, since my parents are not bothered. So sometimes the counselors always refer cases like this, like addictions, to a clinical psychologist or psychiatrist, right? Where we don't really prescribe anything, but we still monitor, right? We still follow up with them. We still see whether this person or the students are still okay, still can manageable their daily routine. So without parents' support, it is very difficult for us, the counselors, especially, to actually monitor the students. They can just come and lie to us, saying that, I already reduced my screen time. I'm not addicted to gaming anymore. I don't sit in my room. I'm spending time with my parents. They can just lie to us. But again, in class, sometimes lecturers will actually share with us saying that, no, this particular student is not performing well, not doing their assignment. So we need many parties to actually help to share information rather than just the counseling sessions, like parents. We need support from the parents, the lecturers, to see whether are they doing what they're supposed to do, right? So basically, this is how I handle my cases. Did I answer your question, Indu?
To add, I agree with Miss Lara. Parents have to play a very important role. So same goes like for us, maybe some of us are parents. We have to show the good example. How do we expect our children not to look at the phone if we are the ones showing that or model that kind of behavior? How do we expect our children to communicate, whereby when they communicate with us, we have always this in front of us with no eye contact. So usually this is the thing that I've been perjuangkan, to have a good eye contact. So we as a parents, we must understand the frustration of children. So at the end of the day, they will resort in internet game because of this. So this is the thing that we need to, rewind balik. Banyak benda yang we have to sort things out. But again, as a parent, we need to show a good example or a good model of behavior, okay, in order for us to see a good behavior from our children, okay. Like myself, as for patients, usually being a clinical psychologist, I will practice this CBT, is a cognitive behavior therapy model in any kind of behavior issues. Okay, for example, if a boy come to me with tantrum or anger management, and due to this excessive gaming, okay, being reported by the parents. So usually I will ask them to write a thought diary. And in psychology, why do we behave in such ways? Is because the antecedents, okay, that makes a behave. And of course, when we behave this way, it will result to the consequences. Usually, if you behave in a bad manner, of course, the consequences will be that way. Okay, so they have to jot down. They have to consciously understand or feel what are the misbehavior that they act. Maybe they shouted at their mom, kan, marah sangat, and then results to any aggressive or abusive kind of behavior. So what would be the possible antecedent? Maybe when mom say that, adik cukup, game dah lama. So that kind of thing, it creates that emotion, anger. So at that time, how many % of anger do the boy or do the patient have? Maybe 100%, maybe 120%. So during that thought diary period, is about 2 weeks. Usually I will do that. So parents or patient will rate them. Okay, this is only applicable for patients yang faham lah, maknanya yang maybe adolescent, not that children, that little children, and that usually the parents will rate. So if we do that thought diary, and then we can see the patterns, okay, at what incident or at what scenarios does the child showed that anger, tantrum, marah and everything. So from there, we can see the real picture and we tackle on that antecedent per se. But personally, being a mom and also treating other patients as well, so I've been facing that issue as well in my family. So what I did is usually I will monitor my kids' internet activity, and I have that limitations. So the only child that plays into internet or gaming, and they play Roblox, they're not into PUBG or Call of Duty, just Roblox and those yang game yang I will say, because I will tapis the content of the games of my sons, my 1 and 2 sons, they are into adolescence right now. So I set the limit, and then at night I will take away their phones and laptops. Okay, you have to give it to mama. And then the most is, for me, is 3 hours. But now this week I've reduced to 2 hours and 30 minutes. So you see, we cannot totally buang ataupun tarik that or stop playing games. So we have to do it. So we have to cut or break it into or reduce in a small quantity. So that is one of the way to face this kind of dependency on any kind of internet. And then I will usually use this rationalizing towards my boys, my sons. So you see, whenever they, because this involves emotions, right? So we have to do this talking, or maybe because I'm a psychologist. So I cakap dekat my kids, I'm not sure whether you are lucky or you are unlucky to have your mom as a clinical psychologist, because I usually do the talking. I will not, I tak membebel, but I will do this. You see, you have changed a lot. When you play this and then you seems like you are in your own world. You are not playing with your little sisters, your little brothers, you don't communicate. When we talk that way, and it makes them realize, it's like macam kena ketuk, So practice that, communicating, and then make them realize actually. So if it's in the early stage, because if you want to practice this kind of thing, when your child enters to severe or chronic addiction, so it's hard. At the very early stage, please practice that as an adult, as a parent, or you have your little brother who are facing this kind of thing, or in fact the whole audience. If you have this experience where your mom keeps on nagging your little brother, your little sister, stop this, cukup lah main, pergi sini. So maybe you can practice the thing or the tips that I've been sharing this. We need to discuss together. You see, this behavior, it has been changing. Before that, you are very obedient. mama minta tolong terus datang, for example, and we have to sort of praise actually the child. So we have to praise you're good, and then lepas tu, and then we rationalizing and then make them realize actually they are, kadang-kadang they don't realize they are having this kind of transition or changing of behaviors.
A lot of what we are or how we become is a result of the psychosocial environment that we grow up in. Okay. Now, we know that from studies, again, 30 to 50% of things we do is genetically predisposed. So even addictions, there's a 30 to 50% predisposition. You could be born with a gene. You could have inherited it from the family and family history and things like that. But the rest of it is conditioned as a result of the environment we grew up in, the parenting style, techniques that we are exposed to, and the way we are conditioned with our friends and our exposure and the community and the society. So when the psychosocial environment is not as stimulating as it should have been, then the person grows up to becoming in a certain way. But as Dr. Hilwa was saying, if we learn to communicate, if we learn to talk, if we learn to express emotions, and we learn to be more open with the way we feel, then you're giving the child a chance to develop into learning and adapting into healthier means of communicating as well. Okay. Another issue that we commonly have in not only in the culture, maybe in the Southeast Asian culture, is something we call codependency. Okay. As adults, sometimes we struggle to be assertive with kids or with people we love. We struggle to say, no, you can't do that, or sorry, this is not acceptable, because we feel that when we say that, we're going to hurt somebody or we're going to upset the person. But the thing is, when sometimes you need to do that to set boundaries, sometimes you need to do that to be clear about this is not acceptable behavior. Maybe it's also cultural again, like as I said before. If someone comes to you and says, hey, can you help me to get this done? Sometimes some of us go that extra mile and neglect ourselves and do it to satisfy the needs of others. But we don't have to do that. It's okay to say no. What I've seen with some of the patients we work with, not only parents, but even with adults, right? They struggle to say, no, I'm sorry, I will not give you the money, right? They struggle to say, no, I'm sorry, I can't give you the 50 ringgit to buy that game. They struggle, they just give it to them because they feel, if I don't give it to him, then he's going to be upset, he's going to be angry with me. But what you're done is you're giving it to him and you're encouraging him to continue getting involved in that activity and getting more addicted or whatever it may be. And sometimes we have the habit of saying no, but. Okay, we should say no, full stop. You know what I mean? There's a difference. We say, yeah, no, but. That means you're giving the person a chance to negotiate. You're giving the person a chance to get what he needs. Again, it's communication techniques, as Dr. Hilwa said rightfully. So we need to be able to say no, full stop. I'm sorry, this is not acceptable behavior. You cannot bring your phone to the dining table. Not acceptable. That's it. Instead of no, but you can use it today. Next time you don't have to use it. I think that's not very ideal. It's a struggle because in our Asian culture, we struggle with honesty in expressing our emotions. I think that's also part of our upbringing and the psychosocial conditioning that takes place. But it's something that we are trying to create awareness with the public. I love you. I care for you. And therefore, I will not allow you to continue doing this. See, that's the message. I'm not allowing you to continue doing this, not because I don't care for you, but it's actually because I care for you. I love you. This is the kind of message that as adults, we should be able to communicate with each other. Not only with kids, with each other as well. So what we do in Solace Wellness is we try and create this awareness. We are mental health treatment providers. We specialize in addictions. That's our main function, main core work. We run a residential treatment facility in Kuala Lumpur. We also have an outpatient clinic in Kuala Lumpur as well, and in a few other places in Singapore, in the Middle East, in Emirates, where we do outpatient work. Besides that, of recently, actually, last year, as a result of the pandemic, we saw a growing need for people seeking help with mental illness, mental health issues, mental wellness. And that's when we started the wellness program. And that gave rise to something called the Employee Assistance Program. Many big organizations, companies, realized that their staff were under a lot of stress and pressure, not only because of the pandemic, but because of so many other stresses. And the pandemic maybe made it worse. So the employers started realizing they needed help. So we have started an employee assistance program as well, where we offer online counseling and telephonic counseling to people who need that. And that has grown over the last year. Besides that, in the academy, we're trying to create more awareness with the public. It talks like this, webinars and talks, and telling people, if you're not well, it's okay, because it's an illness. It's a disease and it's treatable. And there are people out there who can treat you. Please seek help. So that's what we do in a nutshell, actually. So mainly two main types of treatment: residential and outpatient. So residential is where patients come and stay in with us. We have a team of clinicians running a residential treatment facility. They stay on average up to 3 months. So everything is provided: food, therapy, evaluations, assessments, medication if need be. We have a psychiatrist, psychologists, doctors, nurses, counselors. That's in the residential care. We use various treatment models. CBT, as Dr. Hilwa mentioned earlier, is one of those treatment models. And we use alternative therapies as well, like music therapy, art therapy, and psychodrama and things like that. In the outpatient program, we run an outpatient program itself, an intensive outpatient program, where patients come into the clinic on a structure, so like once a week or twice a week, and they see the clinicians by appointments, and we provide them support. If they need psychiatric care, our doctors will see them and provide them medication as well. Then we have online programs, virtually conducted through Zoom and other forms of online programs as well, media as well. So these are the three main treatment approaches that we do: residential, outpatient, online.
With that, ladies and gentlemen, thank you very much for participating in this session. And to all participants, again, please follow Solace Asia on Instagram for more updates on addiction matters, on mental health matters and services. And with that, thank you, everyone.